Unfortunately, chiropractic and physical therapy is not just for the aging population anymore. We're seeing problems with 20-year-olds. We're seeing problems with 30-year-olds who already have these conditions they shouldn't have for 30 more years.
We do have quite an age spectrum that comes in, and different age groups have different goals too. Just like getting your teeth cleaned, you're trying to prevent those cavities, and I think a lot of our pediatric patients who come in for wellness type care is because their parents experience some ache, some pain, and they realize that if they start their kids young, a lot of these things are preventable in a way from them.
These days, it's so much of the push is towards kids playing one sport constantly year-round, so you get all sorts of overuse injuries in 10, 12-year-olds, We get sports injuries in kids that have been doing it for 8 years and they're only 13.
Some parents may like this, some coaches may not like this, what have you, but if someone plays a sport all year round, your body's not designed to do that. There's all kinds of research out there about sports specialization and how you shouldn't specialize till you're 15 or 16. But a lot of times, because the sports are so competitive around here, parents feel that they're going to get behind. When that happens, we get a lot of overuse injuries, rotator cuffs with kids that are 12, constant ankle injuries or constant hip injuries or low back injuries. Kids shouldn't be having that, but usually when they do something over and over and over and they don't take care of their bodies, they don't change it up, they don't do something different, you're going to get those injuries. Obviously, posture drives a lot of chronic disease, but usually it takes the parents to understand that problem and take that step to get their kids checked out.
With all this new technology, with phones, we see kids whose necks only look down for 13 hours a day. So we've seen some 12-year-olds whose spines look worse than 60-year-olds now.
I love treating kids. I think it's the biggest chance you have to make a huge change in someone's life when you can start them early. So I think that's exciting. And certainly for our geriatric population that we have here, it's just keeping them mobile. You want to feel like you're 30 when you're 80, and that's my goal in life. So this is one option that you have to make sure that you don't lose your independence and you're not being held back by pain and discomfort.
Our job is to teach these kids and the adults as well how you can do things at home to maintain your health, maintain your joints. Because if I'm just treating you constantly and not teaching you anything, then you've got to always come to me, and that's not empowering.